right, so I'm going to talk to you about the saliva or spit protocol. So if you've done a flu clinic visits with me, then you've been given handouts on how to do this, but sometimes having a little video to do it with is helpful. And I'm doing it kind of from this type of a side angle so that you can follow left and right. I feel like it can be helpful for those of you that are visual, so you don't get confused left or right side. So any of you who haven't seen me for the flu clinic and you just want to help yourself fight the flu more successfully, this is a standalone treatment that you can do with your own saliva at home if you should start feeling like you're coming down with something. So first signs of a cold or a flu, you want to spit into a jar. I know that sounds gross. Some people hate it, whatever. If it can save you from 7 days of coughing up gunk, go for it, do it. So I just have a little water in here, but let's just assume that that's my spit today. You just need any glass jar and you're going to put it in your hand. I don't care which hand it's in. So first point you're going to do is you're going to do the LI 4 point or large intestine 4 point. It's right along this bone in the soft spot. You're going to massage that. I'm going to speed this up for purposes of just educating, but ideally you should be doing that for 20 seconds each spot or about 20 revolutions. Okay, second spot's the outside of the elbow, right where the crease ends. Do you see right where that crease ends? That's your spot. And you're going to gently rub in a clockwise direction. Can't do it looking at the video. Okay. Then often I switch hands. Okay, switch hands, switch sides. So once again, I want that left elbow, and so I'm doing my left elbow point, my left thumb web space. Once again, you're aiming at doing those 20 revolutions each spot. You're going to do 4 fingers up the inside ankle bone right there. You're going to find that point and you're going to massage that point. Once again, you're still holding this lovely sample that you've collected. Then you're going to do in the soft spot of your big toe and second toe, just up from the big knuckle, and you're going to massage that. You're on the left side of your body right now. And then you go to your right side, right foot, that toe web space right there, okay? You massage that. Then you're going to do right ankle bone just up inside, okay? You rub that for, once again, 20 seconds-ish. And lastly, you're going to come back and you're going to do this hand here. So you can swap the vial or the sample side to side, okay? First time you treat yourself for that spit, you need to sit there and hold that for 15 to 20 minutes. Undisturbed, don't use technology, just treat, let your body rest, let it recalibrate. The second time you're going to do it again in 2 hours if the sore throat or the tickle in your throat isn't gone or the congestion isn't gone. And you're going to spit in a jar again in 2 hours so you get the morphology or the changes or the adaptations that are happening in your saliva and the virus that's stuck in your mouth or has started in your mouth often from how you contracted it through an airborne illness. So in 2 hours you're going to redo those gates. And you're only going to hold that sample 2 minutes because it is a second treatment or a follow-up self-care treatment, okay? So you're going to continue doing that during waking hours every 2 hours as often as possible until no more signs of the flu or cold are there, okay? So you want to do this as often as you can, as soon as you can when you start noticing that you're coming down with something. Don't set it aside, let it get a hold of you, and then be in debt to the illness and be trying to dig yourself out of debt. The sooner you catch it, the quicker you educate your body, the more of a fighting chance it has to resiliently, completely sidestep the illness. Often, sometimes I'll start going to bed and I notice that I just have a bit of a tickle in my throat, doesn't quite feel right. And the days that I'm too tired to get out of bed and go do anything with it, by the time I wake up the next morning, the flu or the cold has me. And then I'm trying to dig out of debt. Takes a whole lot more self-care. Often if I catch it at that first signs in the evening, self-care once before bed, go to sleep, wake up the next morning, maybe self-care the next morning if I have time. and then it's done. So you can literally stop illness dead in its tracks if you just self-care. And these points are very powerful acupuncture points that have a conversation with your body and your immune system. Once again, you're activating them. You're showing them how not to shut down to this spit sample. And so you want to catch it early, give your body the support it needs, and self-care. If it doesn't go away and you end up sick, I can help. So you come in and we have to get a more specific treatment going for you and try to help you kick that to the curb. So once again, self-care for NAET, spit protocol or saliva protocol, so that you don't get colds and flus and viruses, or you get the least amount of colds, flus, and viruses this season. Wishing you luck and hoping to see you at the flu clinic this year. Talk to you soon.